Welcome to the American Retirement Advisor, coming to you from 123Z Studios. Real stories, real strategies, and straight talk about healthcare, retirement income, and inheritance planning. I'm Ian Schaefer, here with Betty. Let's get into it.
A couple sat in our office recently, feeling a sense of relief. They had finally locked in their Medicare coverage. Supplement plan picked, Part D sorted, feeling good. Then one of them asked, "So what about dental?" The answer caught them off guard. Original Medicare doesn't cover routine dental care. No cleanings, no fillings, no dentures. And while we're at it, no routine vision exams or eyeglasses either. They're not alone. This comes up in our office constantly. Why so many retirees get caught off guard? Most people spend their careers on an employer plan that bundles everything together: medical, dental, vision, one card, one payroll deduction. So when they move to Medicare, they assume it works the same way. It doesn't. According to Medicare.gov, original Medicare generally won't cover dental services like cleanings, fillings, extractions, or dentures. Vision is the same story. These are services most retirees use every single year, and paying out of pocket adds up fast. The good news is you're not stuck paying full price at the dentist office. There are real options, and each one works differently depending on your situation. 3 ways to fill the gap. 1. Standalone dental and vision plans. You can buy individual policies that cover the basics: cleanings, exams, and sometimes major work like crowns. But there's a catch worth knowing about. Most standalone dental plans cap their annual benefits somewhere around $1,000 to $1,500. That's fine for 2 cleanings and an X-ray. It won't come close to covering a dental implant, a bridge, or full mouth reconstruction, procedures that can run $5,000 to $30,000 or more. If you're someone who takes your dental health seriously and wants access to advanced care, those annual limits matter. Compare premiums and deductibles against what you'd realistically use before signing up. 2. Medicare Advantage plans with built-in coverage. Some Medicare Advantage plans bundle dental and vision right into the plan. Sounds convenient, and for some people it is. The trade-off? You're locked into a network, and those networks can change year to year. That dentist you've been seeing for 15 years, the one who knows your history, your sensitivities, your preferences, they could be dropped from the network at the next contract renewal, and you'd have no say in it. That's the hidden cost of bundled dental coverage that doesn't show up on the benefit summary. You can compare options in your zip code using Medicare's plan comparison tool, but pay close attention to which providers are actually in network today and ask how often the network has changed. 3. A spouse's employer plan. If your spouse still has group coverage that includes dental and vision, that might be your simplest move. We see this all the time. One spouse enrolls in Medicare, the other stays on the employer plan, and the dental and vision coverage rides along. It's worth running the numbers to see if staying on that plan is actually more cost-effective than going solo. One important detail on this option: if the employer has fewer than 20 employees, Medicare becomes the primary payer. In that case, the retiring spouse may be required to enroll in Medicare Part B during their initial enrollment period to avoid late enrollment penalties down the road. Skipping Part B because you think the employer plan has you covered can lead to a permanent premium surcharge. This is one of those situations where the size of the company changes the rules entirely. Now, here's where it gets interesting. Your supplement doesn't fix this. A lot of people assume their Medicare supplement, Medigap, plan covers dental and vision. It doesn't. Not Plan G, not Plan N, not any of them. Medigap fills gaps in original Medicare's cost sharing, like copays and deductibles. It doesn't add new categories of coverage. So even with a great supplement plan, you still need a separate solution for your teeth and eyes. I wrote about this in Medicare Made 123 Easy because it's one of those details that trips up even the most prepared retirees. The coverage is excellent for what it covers. You just need to know where the edges are. What to do this week? Pull out your current dental and vision plan documents. What are you paying and what are you actually using? If you're on a Medicare supplement, know that you'll need a separate dental and vision solution. Compare before you buy: a standalone plan, a spouse's group coverage, or a Medicare Advantage plan with built-ins. Each has trade-offs that depend on your providers, your budget, and your health. This is exactly the kind of thing we help people sort out every day at American Retirement Advisors. Our advisors sit down with you, review what you've got, compare every option in your area, and help you fill the gaps. No cost to you. Give us a call. It's just a conversation. This is Betty with the American Retirement Advisor. Thanks for listening. If this episode helped you think differently about your retirement, share it with someone who needs to hear it. You can read the full article and browse hundreds more at americanretire.com. And be sure to subscribe so you never miss an episode. We publish daily. See you next time.